welcome you all. It's my pleasure here to start the third webinar of a series of 3 webinars that we had scheduled with a kind collaboration of several people for the International World AIDS Day. This third webinar is in charge of Jerry Galea, Dr. Jerome Galea. He is the Deputy Director of Partners in Health and the co-founder of the LGBT Epicenter Community Center, both organizations in Lima, in Peru. He is also postdoctoral fellow at the Harvard Medical School. He has studied and published on the acceptability of PrEP in Peru and is currently investigating the informal use of PrEP around the world with an online study. The study is called PrEP in the Wild, and he was going to share an interim analysis for that study here. Let me just say before that that this topic is particularly important at this time because, well, PrEP is a new, well, relatively new technology. It has already been recommended by WHO, but very few countries around the world are actually officially using PrEP. Particularly, we're talking about PrEP prescribed by the national health systems, or even better, provided by national healthcare systems. So definitely, we all know the health systems are extremely diverse around the world, and the level of coverage by either the national health system or insurance programs is very diverse as well. Even within country, there are several providers of different degrees of government funding. But definitely, given that PrEP is a relatively complex technology that implies at this point prescription, some screening, recruitment, and then a follow-up process with HIV testing and monitoring of other health issues. It's something that is not as easy as perhaps condom purchase and distribution. It implies a different level of organization. So really, even within, for example, what we call higher income countries, access to PrEP is not there yet. So one important concern that around the world many organizations have is how to make PrEP more available, and at least to start in terms of government involvement. Now, because of that, people around the world have started to organize themselves. Sometimes it's an individual initiative, sometimes it's small groups of people or communities who are starting to do this. And so I guess in my view, Jerry's initiative to implement this study is very, it's very creative, and I think it's going to be very important. We just have to help him make the study well known so that he gets more and more information that is relevant to the main task here. So anyway, just as usual, please write your comments in the chat window, and he will speak, he will present what he has for us. Maybe he will describe how we can help in the subsequent phase of the study, and we can discuss all the implications in the last few minutes of this hour. So I'll stop here and just let Jerry speak. Welcome, Jerry.
Thanks, Carlos, and good morning, afternoon, evening, everybody. Thanks a lot for inviting me to speak in this last of the World's AIDS Day series of NEMUS presentations, Carlos. And I'm excited to be able to present some early results from our global survey on informal PrEP use, the study PrEP in the Wild. What I'd like to do over the next, say, 30 minutes or so that there's enough time for conversation is to tell a little more of the story and how this study came about. I also want to say, for those of you that were at the R4P conference in October in Chicago, the Research for Prevention conference, that these are similar but expanded results that I had presented there. So some of it may be repetitive, but I hope to give more of the story. Also, right up front, I want to thank and include my collaborators, Ryan Cook, Jim Pickett, and Pamina Gorbak. This is a team effort. It's just the spokesperson for today, but we've all played our role in this. So, like many of the research projects I find myself involved in, especially the HIV projects, this one started with a phone call from a friend. So really, while I had provided some support in the as a consultant in the IPREC study back in the day, very limited support, and had also done some previous research on the acceptability of pre-exposure prophylaxis in Peru some time ago. I hadn't really thought much about it after that, primarily because it, until recently, had not been accepted by the kind of Peruvian FDA for prevention. But I got this call one Sunday evening. I suspect many of you, if you're HIV activists or caregivers or both, you've had similar calls. They usually happen on a Sunday because the weekend is past and people are facing the week. And my friend Marco called, and he was worried. He had unprotected or condomless sex the Friday before, and he was wondering. He knew about PrEP, post-exposure prophylaxis, and he knew it was something that he needed to start within the first 72 hours if it was going to be potentially effective. And so he called me. I'm not a physician, but I kind of had the face. I know a lot of people in Peru and had been around the block there and knew where to refer and who to call and get him connected. And so I had that call with him. And his fear is not unfounded. He knew that maybe some estimates have upwards of around 15% of gay men, Peruvian gay men, have HIV. In fact, just looking at Peru, you can see that the HIV prevalence, if you take a point prevalence of 0.4 for the general population, MSM about 31 times greater risk. If you cell sex, it's higher. If you're a trans woman, it's much higher. And these are probably conservative. So his concern, I don't think, was at all unfounded. So I made some calls and got him to see a physician and a clinic that would give PrEP, and he started it. And he's a friend and he knows the work that I do, and so we were talking about it, and he about PrEP and his experience, and he began to ask me about PrEP. He had met other people and was getting, as he was going through this experience of trying to avert an infection, he started wondering about the long term, because this wasn't the first time he had found himself in a panic. And he had, this was a guy that follows the news, reads English and, stuff that I was posting around PrEP, and started to ask me questions. Where could he get it? PrEP was tested in Peru, but not available widely. Still isn't part of the national HIV plan. Wait a minute, he asked. It's not available? Why? Then he met somebody who was taking it and found a way to get it. And so so that got me thinking about if this was the case of Marco. I mean, really, that was the first person I had heard about that had considered acquiring an ARV for prevention. I wondered who else was doing it and how common it was. And certainly Peru is not the only country in which Truvada for PrEP is not part of the National HIV Plan. And so who did I call but Jim Pickett at the AIDS Foundation Chicago, and I started asking him. I was like, have you heard about PrEP being taken, in the wild, kind of, informally? Have you heard of this? What's happening? How are people getting drugs? Don't you need a prescription for that? What are they taking? Is it always Truvada? Is it generic Truvada? Is it something else? Do people do this with doctors involved or other health professionals? What are the guidelines that they're following? Are they the CDC? Are they others? And what about those who try to get PrEP but don't? I really think we need to look at this. And so at the time I had seen that there was one paper published. I believe there's only one paper published still on specifically on informal PrEP use from Australia. In that particular study, they had looked at around 3,600 HIV negative MSM and found that about 2.5% were using ARVs informally before unprotected anal intercourse. And so there was something out there, but certainly nothing on a global perspective and or even within Peru. And so, but to do this, we needed money. Jim made some phone calls and talked to the good people at AVEC, and they provided us with some seed funding to look at current users of PrEP, frustrated users. Those would be people that attempted to get PrEP but for some reason couldn't. And we were also interested in learning about those who were prescribing PrEP. And today I'm going to focus on just the people. I'll tell you much more about the survey in general, but I'm going to really limit the conversation today to people that we call consumers or users of PrEP. And we limited this study to men and women that were at least 18 years of age that reported that they were HIV negative and using or had used PrEP. And we made this a global survey. We deployed it over the internet. And we included all countries, even countries, say, like the United States, where PrEP is part of the national plan and it's fairly accessible, because just because it's approved here doesn't mean that it's not being used informally. And so we will kind of sort through things in the final analyses, but just to be upfront, we really deployed this across the world as much as we could on a small budget. And so this all started about a year ago, of November, December last year is when we started developing the content. We had focus groups from global PrEP advocates on an international call. And probably, actually I can't see the participant list right now, but I'm sure some of you were involved in that. And then we also had key informant consultations with PrEP providers and expert advice from other stakeholders to make sure that we had a robust as possible survey, that we captured as many things that we could without, going overboard. And so the study also was reviewed by the IRB at the UCLA. So the data that were collected or being collected right now for PrEP users include things like socio-demographic survey to get understand of people who are using PrEP and how they self-identify. I have a section on sexual behaviors. It's not a massive section, but we wanted to try to understand how PrEP is being used in the context of sexual practices and behaviors, what people's experience were or are using PrEP, what's being used, which dose, how it's acquired, and what is being paid for it, what medical care is being received and tests, whether pills are being shared, and also, of course, reasons for using PrEP in the first place. And then we also included some questions, a few questions about those who tried but failed to access PrEP to try to understand what was happening there. The survey was launched in English early this year and then was quickly followed by French and Spanish versions. So we have 3 versions of the survey currently live right now. We have, really tried to promote the survey in calls, webinars. Hopefully many of you, all of you, have heard about it already. One way we've really been pushing it is on Facebook, listservs. There are a number of PrEP groups in multiple languages on Facebook, and we've really been getting a decent response there. The survey lasts about 15 minutes, which also includes an online informed consent. And so the analysis that I'll be providing now was from an interim cut that we did late in July prior to the Research for Prevention conference. And so the data are not going to be, the most up to date, but it will start to give you an idea. And we'll be closing the survey probably, we have actually a study call in the next few weeks to decide, but I think we'll probably be closing down the survey this year or right at the beginning of next. So this in some ways is kind of a final push to make sure we get as many people's experiences recorded. So what I can tell you so far, by the end of July, we had amongst PrEP users, amongst users and frustrated users, 314 surveys were completed. I'm hoping we have many more by now. A spread around 29 countries, and definitely weighted towards countries like the UK, where there's been a lot of PrEP activism, if you're following the news there, but also from US, Australia, France, and Mexico. I'm hoping, those were just most respondents, but I'm really hoping that we can get more responses. I'm particularly interested in Latin America and been really pushing this in Latin America, so I'm hoping that we'll get even more responses after today's call. Amongst those users who responded, they ranged in age from 19 to 71. Most were male, most identified as gay, all reported having sex with men, and about a quarter had a current HIV-positive primary partner. So again, I hope that we've been really fairly gender neutral in promoting PrEP. I mean, not always for sure, but I mean, definitely we've tried to really publicize the study across multiple means. Certainly, nowhere does it say it's only directed towards men, but really it's mainly men who are responding. And here are some of the top reasons our respondents say they've been using PrEP, or why they were interested in using PrEP. Really letting go is the top, but also, there are other reasons as well, but a lot of them are fear-based, or as a backup to condoms, or known condomless sex with the HIV-positive person. If we expand that out a little bit, amongst these 262 users. The blue bar is the percent reporting, so you could choose more than one option here. But here's a selection of reasons that people gave for using PrEP. When we asked people about the source of the antiretrovirals, now I'm only going to focus here on people who did not see a medical professional before initiating PrEP. So these were people who initiated PrEP on their own. Maybe they had heard about it, read about it someplace, or heard about it from a friend, or read about it someplace and decided that they were going to get pills and start PrEP, but not under medical supervision. About half of the respondents, a little over, had access to PrEP via the internet. Others, 32% from someone they knew, and then about a fifth from unused post-exposure prophylaxis pills. And so again, expanding that out amongst these 70 respondents, here are all the different ways. By far, the order generics online without a prescription was the most common response, and that is I know that to be happening in Europe a lot, particularly in the UK, where there may even be buying clubs together where people import drugs in that way. But there are some people who travel country to country. I really think this shows also that if you want to get your hands on pills, there are multiple ways to do it. So if you then dig a little bit deeper and you compare those who saw a medical provider before initiating PrEP, so about the 3/4, with those who had not, what we wanted to see is what were the differences in the sorts of tests that were being accessed beforehand, before starting. And you can see that with regards to an HIV test, other STI or sexually transmitted infection tests, hepatitis B test, serum creatinine test for bone mineral density HIV counseling, and referrals for other care. And with the exception of the referrals for other care, these two groups were different for all the other things that we had asked about. So I'll expand it out here a little bit more. You can see that really seeing a provider ensured that most of these tests, most of which are recommended before starting PrEP, especially an HIV test, and hepatitis B tests happened. So you can really see the benefit of seeing a provider before starting PrEP. In terms of the antiretrovirals that were being used, now these are amongst all respondents, those who received. These were so I was just saying these are the ARVs that were being reported. Truvada, generic Truvada, were by far the most common drugs reported. And in terms of frequency of PrEP by users, most reported daily use, but about 69% had reported some interruption in use. Well, amongst those who had tried to access PrEP but did not in the end access it and weren't able to take PrEP, the primary barriers were cost, doctors refusing to prescribe or provide support, issues of legality or illegality to import the ARVs into the country, unable to access continuous supply, side effects, and stigma. So our preliminary conclusions really were that PrEP users were mainly men identifying as gay or gay men using daily Truvada under medical supervision, but nearly a third self-managed their care and ARV access. Among those who had started PrEP without medical consultation, key procedures, including HIV testing, kidney function testing, and sexual health counseling, were frequently admitted. Among all PrEP users, dosing was often less than daily and frequently interrupted. For PrEP to work, we know that regular medical monitoring and adherence and sexual counseling are required in order to prevent HIV monotherapy in case of HIV infection either before or during PrEP initiation. We really believe that healthcare professionals play a key role in identifying and educating persons who could benefit from PrEP, even in settings where PrEP is not yet national policy. Of course, barriers to PrEP access require urgent attention and must include changes in national policies, as well as provider and patient education. So some next steps for our study, which we hope you'll all see within the next few months, is a much more thorough analysis using the full sample size. I'm very interested in also, we all are actually doing regional analyses. There are a number of people, this is really, a community participatory study. There are many, many people that have helped us put this together. We would love to provide regional analyses so that advocates can use these data to advance the PrEP agenda in their countries. And I haven't even begun to dig into the PrEP provider data, but we will also be including an analysis of that. Maybe, I don't know, Carlos, if you'll have us, maybe that would be a nice presentation in the future. In the meantime, please do help us promote the survey one last time. We'd love to give it one last push. If you are a PrEP user or have tried, or a medical provider, please consider taking our survey. There's the link for all 3 languages, or you can scan the code with your smartphone and it'll take you right to the survey. It only takes a few minutes, and we promise to share the data afterwards. So really, that's my presentation. I do want to leave with one last thought. Often when I've been thinking about PrEP personally, or when I've read about it, and I do believe this is really it's really in the context of how do I protect myself? How do I protect myself? And of course, that's what PrEP is about. It's about giving us options to protect ourselves. And at the same time, one of the last questions in the PrEP survey is just an open field where we invite people to give any comments they want. And many, many people have replied, so there's a whole kind of qualitative aspect to the study that we hadn't counted on. But I've been reading through the quotes, and in the context of PrEP being something to protect myself, I found this quote to I don't know if it challenges that view, but I think it expands that view. This person says, the most enlightening part of my PrEP experience is no longer having fear of potentially passing on HIV to someone else. And so what this person is saying is that, yes, HIV is to protect myself, but for him, it's also about knowing that he's HIV negative because he's getting regular testing, and if he's adherent to PrEP, then the chances of actually becoming affected are very, very low, and then passing it on to someone else is even lower, if at all possible. And so I thought this was really a nice way to frame PrEP as good for me, but also good for those with whom I'm having sex that I also want to protect. So I'll stop there. It looks like we have plenty of time for conversation, hopefully, and questions. And I'll pass the microphone back to you, Carlos.
Great, Jerry. Thanks very much. I think it's a very interesting and provocative presentation. But I think Sindra has one question already, but before that, I wanted to ask, given that what wild is may differ according to, I mean, the normal access to medicines or preventive regimes across countries. I mean, in countries where there's no way of accessing, I mean, normally antiretrovirals, for example, out of pocket, normally you get them through the national healthcare system, where this is really the wild. But in countries where, for the most part, people may buy things out of pocket, then this wouldn't be so much of the wild. No? So, how are you defining that?
So really, the way we're defining, you can define wild multiple different ways for sure, and maybe our definition will be polished and primed once we, really go through all of the data with a fine-tooth comb. But the way we had originally conceptualized it was, if you take the hard definition of, you go to your doctor, PrEP is prescribed, you get a prescription, and someone provides it. That's, if you compare it to that, everything else is quote-unquote wild. So I think it kind of just depends on how you look at it. What I didn't expect is that there would be so many people within countries that have approved PrEP also kind of using it informally. So wild and informal. Informally just means, I guess it's however you define it, but we are defining it as, right now, say, in the U.S., PrEP is a daily pill. And so if you're not using it that way, under medical supervision, then it's some degree of informality. And that's kind of, or wild really points towards that.
Yeah, but I think you've articulated it because for example, when you have access to a prescription, I could imagine that people are getting it on their own because they don't have access to the actual drug because of the insurance or coverage or whatever. Normally, it's not available in their countries. So I imagine that's, for example, here, I think there are doctors like Juan Vicente who prescribe PrEP, but it's and at present you can buy it out of pocket in the pharmacy. So it's
right.
But it's not provided by the health system yet. We hope it's going to happen. So I don't know if, for example, a patient buying it out of pocket would, qualify for PrEP in the wild, that kind of thing. So. Yeah.
Yeah, no, definitely they would. So if one prescribes PrEP to somebody, we would be interested in one completing the questionnaire and any of his patients, because he's providing PrEP outside of the formal national HIV policy for the country, even if it's legal to do so. So there's a broad definition of wild that will filter through to, I think there will be varying degrees. I don't think it's a binary thing. I think there will be some people, that are completely out there on their own, that have read something and have a friend, or maybe, get the pills. They're not buying them. Maybe they're shared or whatever. But then there are people that, are probably getting as good as care as if there were a national HIV policy. Say, for example, Juan's patients are probably getting those care. So they're different ends of the spectrum of the informality, I guess. Well, it's a good question though, and it's something we'll have to define and articulate clearly when we write this up.
Yeah, I think it has to be discussed, because in the private sector, in many cases, for many other diseases, you just get a prescription, and either you get the drugs or treatment through your private insurance, or you buy that out of pocket, and it's not
Right.
informal. No, and
Right.
actually,
Right.
yeah, and PrEP here is already, approval for tenofovir emtricitabine for prevention has already been approved, although it's not officially part of the national HIV prevention program. So, I think perhaps it's not in the guideline explicitly, but it's not forbidden either. So I think it's a little bit in the middle. Anyway,
yeah. But let me just say one other thing, Carlos. I think I totally agree with you. I just want to emphasize that PrEP is more than getting an ARV in someone's mouth. It's all of the wraparound services that should be going with that, including HIV testing, kidney function. Those sorts of things need to, or hepatitis B, to make sure that you're not accidentally treating somebody for HEP when you give them Truvada. So it's what we're really interested is really seeing, by saying it's in the wild, we're not saying that it's necessarily bad. There's really no value on there. But if you're taking, but PrEP is not a do-it-yourself intervention. It's not something that we believe that, and I think actually most people would argue for one's own health that you should start without having at least a conversation with a medical provider and getting essential ancillary tests done before you start the medication. So even in settings where it's like in Peru, if those other services aren't happening, then there could be risks to that person's health. Probably not, drug resistance for HIV, but other things could happen, like, liver flare or things of that nature.
Yeah, although for that you need physicians who are qualified for that. No, so part of the access implies to have more and more physicians able to do this. Also,
right.
In some cases, physicians can do more harm than good, But anyway, so let me just move to Sindra Foyer's question. What is the difference between this survey and Europe's flash survey? How do they complement each other? Thanks.
Good question. Hi, Sindra. I did not take the flash survey, so I'm not. If there might be somebody better to answer that question. I did see, however, the quickly, and I downloaded it and need to read it more thoroughly. But the flash survey, my take on it was that it was not. My understanding, please correct me if I'm wrong, was that it was looking at really the PrEP user characteristics, and who really describing the users of PrEP, but was not specifically focused on informal use. It's my understanding. Although you could argue that in most of the countries, or many of the countries in Europe, it may have amounted to that. But Carlos, are you more familiar with the flash survey?
No, honestly, no. But maybe Sindra can.
Yeah.
If you want, if Sindra wants, she's welcome to explain it. Definitely.
Okay. Hi guys. Hi Jerome.
Sindra.
Thanks for the presentation. Can you guys hear me?
Yeah.
I have not yet been able. They released their survey recently. I haven't had the time to read it. That's why I was asking you, but I will.
But that's what I saw. I saw it really, trying to figure it, really describing users. Whereas we're in part describing users, but really our focus is on what's happening in the process. What are people getting or not getting? What are they paying? What are the ancillary things? Whereas I saw in my very quick read of this, and I think it was just like Thursday or Friday, I saw the email and quickly read through it, was that there were lots of descriptive information about the people that we're using. But
so maybe we, if we have time, do our homework and see how all this data might be able to be presented together to make sort of a summation of what's going on globally.
Mm-hmm.
And I think this is really surprising to me because it touches on many phenomena that are in a way coalescing. No, for example, the issue of offering tenofovir or Truvada as a party drug, no, and a drug dealer, things like that. No, so I guess it implies something that it's really underground and it's linked to sex or sex that is considered kind of weekend sex or whatever. No, whereas and that's one pattern. In other cases, you have something much more organized, much more good boy pattern of a pattern that is much more good boy kind of, no, and so really. I hope at some point you are able to actually define that constellation of different patterns that imply that are a reflection partly of the different situations across countries. No, definitely the cost, the local cost, the availability through the pharmacies is a big factor there. If it's commercially available, even if it's expensive, it's one thing. If you have to really import it through the internet, it's a different thing. No, so I guess probably it would be important that you kind of classify the context because the context defines what is wild and what is not. No, and based on that,
Right.
you can, yeah, you can define in a better way that diversity. Anyway, I will move to a couple of questions, comments that Hamid from Mexico had. His first, he was saying this is very good. He's happy for you sharing your research. He's impressed that most of participants, 2/3 of them, took the laboratory tests before starting PrEP. No, he says he thought it would be higher. I wonder if he means higher or lower. I don't know. Anyway, what do you say?
Well, based on the following, the comment just a little bit lower, yeah, I mean, that should be, 100% of the people, right, before starting PrEP. So, yeah, I mean, I think I've been, I've really only started to really start to consider what this meant, what these data might mean, and, we'll be having conversations in the analysis, but I've been thinking about this in terms of well, Jim Pickett always says that PrEP is a gateway drug. Usually that's a bad thing to say that something one drug leads to other drugs, but what he really means, and which I really agree with, is that I think PrEP has to go beyond again getting pills in mouths, although that is a big part of it. But it's a gateway to a full menu of services. It can be a great gateway to HIV testing and counseling, STI counseling, but also other services, mental health counseling, drug and alcohol use counseling, and so on and so forth. And so I think, yes, everyone should be getting an HIV test, but this can also be a way to engage people in services that go beyond HIV. And also, wanting to access PrEP doesn't mean that it's right for everybody or that they should be, that everybody should be taking it. I think it depends on your case.
Yeah. Well, Hamid also mentions the issue of some people taking PrEP without knowing their HIV status. How frequent it was, and I mean, how have you? I mean, I think it's really one of the best examples of the wild. No, and so what have you? I mean, discussed or analyzed about this particular issue?
Well, I mean, beyond the data that I just presented, I mean, we haven't. You know, that will be, that's our next task, is to really distill this down, you know, much further. I put emphasis on the fact that this is, you know, a cut that was made a few months ago, and what you see is kind of just the distance we've gone with it so far. But it's clear that for those who started PrEP with medical advice, they were much more likely to at least get an HIV test compared to those who didn't. And so, you know, everybody should be getting an HIV test. So, I mean, I don't think there's any argument on that.
Yeah, I mean, it's obviously, it's the very definition of PrEP is actually pre-exposure prophylaxis. If you're not sure of that, I mean, really, it may not even be prophylaxis at all, and it's actually really iatrogenic practice, to say the least. Anyway,
Right.
iatrogenic. Something else I wanted to ask. You had expressed concerns about the actual countries from which people were responding to the survey. Could you actually mention that again, and why do you think that's the case?
I'm sorry, do you mean?
I think you mentioned that most people, at least half of them, came from higher income countries.
Right. Yeah, I mean, I attribute that to the fact that there are very mobilized PrEP advocates / communities, particularly in the UK, but also in Germany and elsewhere. I mean, those are the ones that I've heard the most about, that have, you know, really been challenging, particularly in the UK. At least that's, I mean, at least that's the one that I'm the most aware of, where you've got researchers and advocates where they've also have had, you know, research into PrEP, but where the national healthcare system, my understanding, still doesn't provide it. They were happy to treat HIV with ARVs, but not prevent it. And so those folks have been, you know, were really helpful and really helped move the questionnaire. My finding is that I was in Mexico last month, and then also just talking in Peru, but I'm part of a larger network of activists in Latin America, where HIV prevention and whole health is a component, but definitely PrEP is on the agenda. And, you know, except for in a few places, really, I don't think there's still a huge awareness. I mean, Peru is, I think, a little bit of an outlier because of the IPREC study, maybe Ecuador, Brazil, but, you know, it's been harder to get traction. I was hoping to get many more responses throughout Latin America, but you know, that hasn't been the case. Language could be a barrier in some places as well, though. I mean, of course, it's in Spanish, but you know, or access to internet is an obvious barrier too to filling out this questionnaire. We have very few responses throughout Africa. So, but this was also a few months ago, and we've made a push at a few conferences and webinars. So hopefully, you know, we'll have more responses. But
yeah, I think that it may just be that it's not part of common sense in many cases for people to use PrEP yet. I mean, it's not just an issue of people being aware. It's also an issue of feeling that this is something that you could be doing, and more importantly, it implies that you recognize that you're not using, well, it doesn't contradict the use of condoms, but normally common sense in the traditional way would just imply answering, well, you're using condoms, you don't need PrEP. So I guess it implies some level of self-analysis or the ability to discuss with others, some recognition of reality. No, so I guess it.
Right. Or maybe even, Carlos, it goes even a step before that, realizing you're at risk in the first place.
Mm-hmm.
You know, if you don't recognize that you're at risk of HIV and to begin with, or feel like, you know, you're aware of HIV, but don't, you know, not, if you're not kind of engaged. I mean, I don't know where in Peru conversations of PrEP are really happening beyond academic circles and the few places that actually have specialized services for MSM. I sincerely doubt PrEP is a conversation at the level of the Ministry of Health, for example. Maybe with the exception of a few providers. So, and that may be the case in lots of places. So.
Yeah, it's being discussed as a potential policy. I mean, starting to be discussed, but I think, yeah, I would even say, more importantly, to what extent it's being discussed at the community level, in parties, I mean, among activists, or I don't think it's so clear yet. No, so that's also very important. I mean, community pressure. To what extent people are already able to I mean, articulate a discourse, a demand in this regard.
Right.
I have a comment here from Giovanni Ravasi from PAHO. Congratulations, Jerry. Very interesting data. We need to discuss how to amplify response from Latin America and the Caribbean, maybe within the task force. I mean, Jerry is part of the regional task force on PrEP. We hope to have a presentation from this task force in the near future, in fact. It is very important information to use for advocacy and also to have a clearer picture of the current access to PrEP in our region. That was Giovanni's comment. I don't know if you... Anyway.
Thanks, yeah. Thank you. Yeah, I hope so. And like I said, I mean, I know we're just down to the last few minutes, but I just want to, you know, reiterate that it is our entire goal to be as, to move quickly with the data we have and to disseminate it beyond, you know, a single journal article. But also to make it really useful for people that helped us put it together so they can use it in their communities, including in Latin America. And so that has been our commitment from the beginning and our promise to AVAC, and we will certainly do so. And so I encourage anybody that has a specific interest or for their community or an idea or a comment, if you haven't said so here, please drop me an email or any of the co-investigators, and we'll be very open to discussing.
Yeah. Before we end, because we need to end soon, I wonder if, for example, have you thought of, or maybe you already have some kind of advisory committee, or I mean. Because given, I think this kind of information can be extremely useful for policy. No, it's implementation science. So maybe it would benefit from having people involved in programs around the world. You know, some kind of small advisory committee, advisory panel, and you could discuss preliminary findings. So that's one thing, and the other is to what extent. I mean, this study, well, it's a survey, but so you have a questionnaire there already, but if people recommended that you added something or introduce something, would you still be able to do that, or you won't make any change in that regard? So I don't know.
So for the advisory committee comment, I think that's an excellent comment, and I think we should do that. And the place I would start is with the many people who helped us already, activists. But so I think that's a good idea, Carlos. For the second issue around, changing the survey, at this point, we're really starting to wrap it up. We have promised to have a report a report based on the final data set in the next month or so. So we're not changing that, but this was a small preliminary study. So one idea would be to see where to go with this and really see what the salient issues were and where we need to explore deeper and what the next potential studies could be.
Yeah, it seems to me that it can be sort of the initial step towards a monitoring system that could exist. An ongoing thing for
right.
For informal access to PrEP. I think intelligence about PrEP utilization, and besides health systems, the formal health systems, I think this could be very useful, and if it's well designed. So I guess one of the sort of benefits of this study and similar ones would be in terms of the design of that kind of sort of ongoing monitoring system.
Yeah, totally. I've thought about the same.
Yeah, well, anyway, it's the hour already, and it's been great to have you here with us today. It's been provocative and useful. So, as usual, we have recorded this session and we'll be uploading it to the site and to our YouTube channel. So, Jerry, thanks again for being here with us. And
my pleasure.
And thanks to all those who were with us today. We'll talk soon, and actually, if we can't, we will probably send a message via email. But in any event, if we don't talk before, have a nice holiday and best wishes for next year. Thanks.
Thanks, Carlos. Bye. Goodbye.